Okay, hello everyone, and welcome back for our next lecture. Today we'll be talking about diabetes, and not so much as with previous lectures, we've spoken about the two different angles that we could look at, and one of them is sort of from a medical perspective, and another one is from an educational perspective, and how it affects you as far as being a childcare worker, education support worker, those types of things. So while we do cover some of the medical stuff, because it's important for you to know at least the basics, the two things I will say is that firstly, if you are working with children that do have diabetes, then please do a bit of research, especially if you may not work with them for the next few years and then you come across a child that has a particular disability, and that goes with all disabilities. Secondly, make sure that you're working with the other staff members. They will have an action plan or a medical plan or food plan, these types of things, medication plan and so forth. So it's important that you're communicating with other staff and knowing what your responsibilities are specifically. Are you responsible for making sure that the child isn't getting sick during the day? For example, or are you responsible for their medication? Are you responsible to make sure they're eating the appropriate food and managing their sort of health during the day, looking out for, with diabetes, for example, testing and making sure that their mood is at an appropriate level, or if they're starting to get moody, does that mean that they're beginning to get in trouble? Does that mean they need to eat or whatnot? So it's up to you to figure out what you need to do. Don't just simply rely on going to work every day and not really taking any responsibility. Make sure you're proactive and asking those questions. Am I in charge of this? Is it my responsibility? Is it someone else's responsibility? And just be very clear, because if something does happen, then you don't want it to come back on you. And therefore, if it is your responsibility, then you know you need to do the research. You know you're the one that needs to read the medical stuff, talk to the parents, those types of things. Although, obviously, if you're working with those kids every day and it's not your responsibility, but you're working very close with them, then it's still worth learning all the ins and outs of that particular child and what can happen and what can trigger and what's expected of them as far as things like medication and diet and whatnot. And I'm talking a bit more broadly here, not just about diabetes, because obviously with all different disabilities there are additional care needs. Okay, so today we're talking about diabetes, which a lot of people will be very familiar with. It is obviously quite common in Australia. A lot of people have diabetes. Now, diabetes occurs when the body is not able to use the carbohydrates in the food properly because the pancreas does not produce insulin effectively. Now, I'm not going to spend too much time talking about diabetes from that medical point of view, from a definitions point of view. I think if you would like to learn more about diabetes, then please do the research. If that's your disability of choice, as far as any research projects you need to do for your assessments, depending on which course you're doing, then please do the additional research. Quite often we have lots of additional readings and videos and things like that available through your online portal as well. There are a few different types of diabetes, which we will look at in a minute. Diabetes may not be caused from a poor lifestyle, and that's diabetes type 1. So not necessarily caused by overeating and eating bad foods over a long period of time and those types of things. It could be caused from an autoimmune condition or through pregnancy. Now, these are the various different types of diabetes. Even just before I made this lecture, I was watching the ABC News and they were talking about obesity and touching on diabetes. So I think everyone would have heard of type 1 and type 2 diabetes. Now, if you can't remember the difference, Again, don't be too concerned here. We're not medical professionals. We're not expected to be. We're not training you to be. All you need to remember is that with any disability, there are additional care needs and there are strategies that need to be put in place. And you need to be very clear about what those strategies are, whether they're ones you come up with yourself and work with your colleagues to implement, or whether they're ones that are given to you and you're told by your superiors that, for this particular child, this is what we're doing. So type 1, autoimmune, so that's the one that essentially people are born with, not caused by lifestyle or by age, poor diet, those types of things, which is type 2 diabetes. Gestational, which is obviously has to do with pregnancy. We probably won't say too much about that one. And juvenile, so that's a type 1 diabetes in children. Alrighty, so what is diabetes? Firstly, it's a chronic health condition. So by chronic, it means serious, long-term, and can cause significant effects, such as ultimately death. The body is unable to use carbohydrates in the food because the pancreas is not functioning correctly. The pancreas makes insulin, and if not enough insulin is produced or is ineffective, the body cannot use the carbohydrates and function as it should. And glucose, which comes from carbohydrates, which gives us energy and is stored in the liver. Insulin is needed to move the glucose into the cells from the liver so that the body can use it. And if the glucose is not used, it builds up in the blood, and if it gets too high, this can lead to diabetes. Now, if you want to learn the ins and outs of how the different types of diabetes works, and the causes, and what specifically the medical and physiology behind it, beyond the sort of the very basics that we describe here, then please go and do your research. We're definitely not saying that we are medical professionals in this sense. We're only just covering the basics and trying to concentrate on what it means for you as someone that works in the educational world, whether that's childcare or in a school. And what that means for you is following certain action plans. It's not so much knowing the medical side of it. And with most disabilities, obviously, you do your research, but please learn the strategies. That's where you should be concentrating your research on, talking to your colleagues, learning what to do in certain situations. And of course, for those that have worked in places like schools or childcare centres before, you'll know the classic one these days is anaphylaxis. So having your EpiPen or AniPen ready in a certain location. Some of them are kept in fridges or whatnot. Others are just kept in their bag. And if a certain thing happens, if someone's allergic to honey, for example, or which one of our staff members at the moment is highly allergic and has had recent incidents. So knowing exactly what to do is extremely important because you've only got a matter of seconds, and knowing how to manage that workplace and what to look out for so that incidents are prevented is very, very important, especially with children because it's a very dynamic environment. So we're more so not looking at what causes anaphylaxis as an example, but what you need to do as the person in the actual field dealing with it on a day-to-day basis. Some facts: it's the fastest growing chronic disease in Australia, and it has to be treated. Untreated diabetes can cause heart attack, stroke, kidney damage, blindness, amputation, and probably, I would say, a whole raft of other things. There is no cure for type 1 diabetes. It is a lifelong disability with a need for lifestyle adaptation in order to manage the diabetes, which we'll have a look at later. Now, here's some statistics. I probably won't go through all of these because they are quite small. 4% of Australians have diabetes. That's around 999,000 people. has risen from 1.5% in 1989. So in about 25 odd years, the rate of diabetes has obviously gone up. 2,367 people were newly diagnosed with type 1 diabetes in 2011. Now I wonder if that number, that seems quite low. I think that might be specifically in Western Australia, given that there's 1 million people with it. So I'd say there's be a hell of a lot more than that diagnosed with it each year. So that must be just in Western Australia. 1 in 20 pregnancies are affected by diabetes. That's the gestational diabetes we were talking about earlier. And the 3 to 1, so the proportion of people with diabetes in the Indigenous population compared to the proportion of people with diabetes in the non-Indigenous population. So what they're saying there is that as a proportion, so per 100 for example, Indigenous people have a higher rate of diabetes. Okay, what is the difference between type 1 and type 2 diabetes? Type 1 is an autoimmune condition. The body's defense, or the immune system, attacks the healthy cells in the pancreas and destroys them. The cells are needed to produce insulin and control blood sugar levels. Now, obviously, as far as you're concerned, if you didn't know the difference between type 1 or type 2, I don't think it would make a huge difference, so long as you knew specifically, so long as you were very aware of what the strategies were, what you needed to look out for, what you had to do as a staff member on the particular day or particular shift, where you're working. So don't be too concerned again with the medical. I don't want people to be taking notes and memorizing these types of things. But of course, the more you can learn and the more you can remember, obviously, the better. Type 2, commonly called lifestyle diabetes. Now, this is the one, is when not enough insulin or an ineffective insulin is produced. This is the one that you see them talking about on TV and on the news, and it's the one where people have caused by poor dieting and poor lifestyle choices and not a lack of exercise and things like that. Signs of diabetes: thirst, frequent urination, lethargy or excessive tiredness, blurred vision. Type 1, sudden unexplained weight loss, and type 2, possible weight gain. Infections or wounds that do not heal. Constant hunger and mood swings. Now, the mood swings is probably an important one for you guys, because one of the key, and we'd all know that if we haven't eaten for a while, we get a bit moody. So if you've got a student or a child with diabetes and you're looking after them for the day and suddenly they're in a really bad mood, then you know that that is a number one sign that you might have a little bit of a problem. Okay, so really be keeping an eye out for that, and that's probably the most obvious one in my experience. And the other one is the breath. Quite often people talk about with diabetes when they're getting to that stage where there are problems, then you can sort of smell their breath, sort of like when you're about to, when you're going on a diet and you haven't eaten for a while and your blood sugar levels are low, it causes that bad breath. I think off the top of my head, is that called ketosis or something like that? But you can look that up if you're really keen. What is the difference between hypo and hyperglycemia? So again, don't be too concerned with that, but hypo obviously means it's low. Hypothermia, low temperature, that kind of thing. Hyper means it's high, so high temperature. So in this case, the hypo means the blood glucose levels are too low. So when you do the test, it's 4.0 or below. And hyper is when it's too high. Now, typically, I could be wrong here, but typically the issue usually is the first one, so it's usually the hypoglycemia, and that's where the glucose levels, so the sugar levels, are usually too low, and that's where you'll see people giving jelly beans and things like that, just to boost their levels a little bit. And as we were talking about earlier, even people that don't have diabetes, you can, if you haven't eaten for a while, you start to notice that you get a bit grumpy. Okay, there's an example of the test there. We won't get into this stuff, but you're welcome to read through this in your own time if you'd like. Importantly, number 5 down there, an action plan. So children will have will know generally, depending on their age, but they will know how to manage their diabetes themselves in most cases, although sometimes you might come across a child, for example, who has other disabilities, so it might become more of an issue. And you can see down there that number 5, an action plan is needed. So all students will and children will have some type of action plan. So you'll know when to call parents, when to call an ambulance, when to call the school nurse, and when to give jelly beans and so on. Okay, so hypo, we've already spoken about hypo. Now these are some of the things. Fast heartbeat, headache, shaky or dizzy, hungry, tearful or crying, sweaty, lack of concentration, confused, drowsy or weak, blurred vision, and angry or moody. So just remember hypo as in hypothermia. Hypo means low, and when blood sugar levels are low, probably the first thing you do is a test, but you would actually notice especially changes in mood, concentration, things like that. So try not eating for 8 hours, 12 hours or whatever, and then concentrating. If you've skipped breakfast and lunch, you get to that 3 o'clock stage where you find it a bit difficult to sit down and concentrate on something. That same sort of feeling or that same sort of idea, but it can happen at various different times of the day, obviously, and it doesn't necessarily take a person with diabetes. They don't necessarily need to fast for a long period of time to have hypoglycemia. Low blood glucose can be caused by too much exercise, so that's obviously as you exercise you're using up all the glucose in the system. Missing meals or not having enough food, alcohol, incorrect medication, or too much insulin. Alright, so again, now step 1, if if you do notice any signs or symptoms, the first thing you'll need to do is the test. And again, most children will do that regularly throughout the day or at regular intervals, or whenever they feel whenever they can feel the signs and symptoms coming on. And of course, it depends on their age, it depends on their maturity, whether they've got other disabilities, about what level of involvement you have in that process. Number 2 is to give them a few jelly beans. Number 3 is to wait, and then retest. And obviously, if their levels are still too low, additional treatment. Got a picture of the banana there. What happens to us if a student doesn't know that their blood glucose level is too low? So, firstly, they can pass out. When learning about a student's glucose levels, testing after a little while after exercise is a good idea, just to prevent a possible low hypo. So remember that hypo is low, as in hypothermia, and hyper is high. So hypo is typically the issue. Okay, when a type 1 person is unwell, so this is the one that isn't caused by lifestyle factors, so it isn't caused by, you don't get to the age of 50 or 60 and develop type 2 because you're significantly overweight and so on and so forth. Check blood glucose every 2 to 4 hours. Check urine or blood for ketones, and again, I very much doubt as a EA you'll be doing that, but some might. It really depends on where you're working. Take insulin, drink fluids every hour, and eating healthy, regular meals. What a type 1 person, when a type 1 person is unwell, vomiting or ketones in the blood or urine can occur, and call the hospital. But again, you'll have an action plan in place, which clearly says this is what should happen in these circumstances. So I definitely, in this particular presentation, in the half an hour or so that we've got here, I don't want you to be saying this is exactly what you should do in this situation. So the disclaimer here is make sure you're talking to the people in charge, make sure you're talking to parents and nurses and stuff like that, who will give you the correct instructions for that particular child. Staying healthy, I think that applies to pretty much everyone. We won't have a look at that. Different types of treatments. So injections is common, an insulin pump, islet cell transplants. Lifestyle changes that include healthy foods, exercise, and moderate alcohol. While, however, important, is not a cure, but is definitely a part of the plan for type 1 and type 2 as well. Strategies for EAs and obviously childcare workers as well. So this is the important part. Don't worry about the medical stuff so much. You've got type 1, you've got type 2. If you're not 100% full bottle on that, then don't worry about it. I mean, if you were a parent with a child that has diabetes, then you would probably know a lot more than I do, and a lot more than most EAs do, or childcare workers when it comes to diabetes. Because really, for working in these industries, what we're looking at is the strategies. That's the most important part for us, making sure that no one ends up in hospital and incidents don't occur, and knowing how to manage those incidents. And we're really just following directions that are given to us by medical professionals and parents and things like that. So, students with diabetes require a few modifications to their routine. And again, each student will be different. Each parent will have different requests, and doctors will give different advice. Easy access to a drink bottle, keeping hydrated, toilet pass for frequent trips, access to snacks throughout the day, a privacy room for insulin testing and injection. Extra time in tests, stressful conditions can make an impact, as well as the time spent for extra drinking and toilet trips. Educating peers on what to look out for if the student their levels are low. So that's things like keeping an eye out if you notice mood swings, for example. Okay, can a student still have sugar? In small amounts. So, for example, if you're having an end-of-year class party, providing healthy options is important. And remember that the teachers or the childcare centre directors, they may forget. It's horrible to say, but they may, because they're running around doing lots of other stuff. If you're in a high school setting, for example, quite often you'll have a teacher that has a class of 30, say year 9, but they'll have 6 or 7 classes of 30, and they spend 40 minutes or an hour with each. So they may not even know that a student has disabilities. Has a certain disability or has diabetes, and students certainly generally don't advertise it. The line managers might, but that information might not get passed down. So if you're aware of that and you're working in those sort of environments, then definitely assisting in any way you can is important. What is a structured eating plan? Healthy snacks and meals throughout the day to keep the glucose levels constant. Sport, be careful not to overdo it. Extra testing, but be wary of false negative results. And why has a student's mood changed? If they're getting snappy, swearing, short-tempered or tearful, means the student is having a low and of course from there jelly beans, and additional testing is required. Now I have seen jelly beans being used, and it is pretty common. Sometimes it's just 2 or 3. That's all that's required, and retesting. It depends on the severity of the situation. But of course, talk to the people that really know what they're talking about there. Talk to parents, talk to the nurses if there's one at the school, and those type of people. Okay, and that's pretty much it. Definitely worth researching and following up if you're working with kids that do have diabetes. Quite often you'll have kids that do have diabetes in your class and you won't even know. Um, and you may not find out, which I guess you can't really do much if you don't get told. I mean, I've worked in schools before where there have been kids with anaphylaxis, and you just don't find out. I remember seeing, after working at a school for a couple of years, seeing a anaphylaxis action plan hanging on the wall, and I just never really read it. There's hundreds of things hanging on the wall, and I've just never had time, and no one's really ever told me. And suddenly you go, oh, that kid that I've got in my class that I am with 6 hours a week is allergic to this, that, and all the others. So don't assume that because a parent walked into a school and said, oh, my child has diabetes, that suddenly everyone in the school or the childcare centre will know. I mean, remember, a lot of teachers are teaching during a week upwards of 200, 300 kids, and then you've got relief teachers, you've got new staff coming in all the time. So it's important that you do your own research and help inform other staff, inform other children to help manage those particular disabilities. And I just want to move away from diabetes a little bit and just talk for 1 or 2 minutes about disabilities in general. Now that you've listened to probably 4 or 5 of these type of lectures, you'll notice that the strategies are pretty much very similar for all of them. So besides the disabilities that we'll get to later that require additional tools and devices such as mobility tools, wheelchairs, those types of things, hoists. Besides those obvious disability-specific requirements, the strategies from an educational point of view are very, very similar across the board. And even if you take one step back from the strategies, really what you're thinking about before you start the day is, okay, well, or even start the week or term, what sort of educational outcomes do we want? So if you're in a childcare setting, you're thinking about, well, gross motor skills, for example, is what we want to concentrate on for the next few weeks. Fine motor skills, maybe it's imagination through play is something that you might want to look at. Okay, so how would you get them from point A to point B? How can you further develop their skills in those specific areas? And even if you're working in a classroom and you're working with a particular child, and you're with them for 1 hour or a day or whatever, thinking about how you can get them from point A to point B, given the specific requirements of that disability. So you'll come up with your own little strategies, and we've covered probably 50 different strategies so far. Visual timetables, for example, as a behaviour management strategy, social stories as a strategy to teach how to behave in a certain situation, scaffolding as a way to teach a particular skill or a bit of knowledge that might be a little bit more complex or complicated. So thinking in advance is the number one strategy, and it's the overarching strategy that sort of covers education and professionals. It's about planning, sort of being, if you're building a house, you spend a lot of time planning, a lot of time getting the right permissions and talking to the right people and looking at what type of tiles you want and this type of stuff. So again, you're spending a huge period of time planning, and then the house goes up in 6 to 8 weeks or whatever. So the same in this industry. If you're working with people, thinking in advance, talking to people, and researching the different strategies that you'll use, and then doing that prior preparation for when you're actually in class or conducting activities will mean that you're a lot less stressed, and it'll mean that you enjoy your job a lot more, and it'll mean that you're behaving in a much more professional manner, but it also means that the educational outcomes for the students will be much greatly enhanced.